we're going to talk about addiction. Sin, disease, or psychological defect. I did that psychological defect over the last 6 months since we originally put this together. But just taking a poll here of the audience, who feels that addictions are a sin or moral issue? Who believes that they're a disease, chemical imbalance, medical issue? Okay, some more hands. Who believes that they're a psychological defect? You know, we have this term addictive personality. Hands? Okay, about evenly spaced. Now, who believes that it's all three of these? All right, good. Well, we can just go home now then. Right, that's where I am. It's really all three of these. And I'm going to present some science and Bible and sort of intermix the two so that we have a good foundation understanding of where addictions come from, how they affect us, and how we can intervene and treat people with addiction situations. So, you know, as a psychiatrist and people yourselves as you treat people, we certainly see clergy saying it's sin, the medical community saying it's a disease, and the psychological community saying it's psychological defect while the person's sitting there drowning, right? And there's arguments going on and the person's sitting there and there's no tangible help because we're theoretically trying to figure out what's going on. I want to share a little bit about my story, but that was me there as a drowning person a while back with an alcohol addiction. I want to share with you the process that I went through and how I then work with patients using that personal process that God laid on my heart. So what we're going to do is we're going to look at addiction, just look at some basics and a definition and who's affected. We're going to look at a model that we can help understand what addictions are, you know, how are they caused and how can we understand them a little bit more clearly so that we can learn how to intervene. What's our treatment goal? We're shooting for the mind of Christ, being conformed to Christ's likeness. We're going to look at some treatment obstacles, spiritual warfare, Satan, our flesh. And then we're going to introduce a treatment strategy that I've used in my personal life and in my practice, adolescent units, Christian addiction recovery units, outpatient support groups called SPEARS. All right, well, in psychiatry we have a Bible, certainly very effective and accurate Bible called the DSM-4. But that's what we use to describe our psychiatric illnesses. So we're going to start there as far as looking at a definition. So substance abuse, not addiction, but substance abuse is one or more of the following four symptoms. Failure to fulfill major obligations, use when physically hazardous, recurrent legal problems, and recurrent social or interpersonal problems. So you're using a substance, using it substantially, and causing one of these four is substance abuse. Now, substance dependence, that addiction element that we talk about, person using a substance significantly and has three of the following six symptoms. Develop a high tolerance, meaning they need more over time to get the same effect as they first had from it. That there's some withdrawal symptoms, so when they stop it, there's some physiological disruption that they feel. That they have increased consumption over a period of time of drinking more and more. They've tried to cut down and have been unsuccessful at trying to cut down. They start to obsess about it more and more, so the time that they spend obtaining, using, or thinking about substance abuse starts to replace their social, occupational, or recreational activities. And then they continue to use despite all kinds of adverse circumstances in their private life, personal life, occupational, legal, financial. I mean, we've all seen those things happen. Now, real addiction, you know, those addictions, you know, are substances that those symptoms are for, and categorizing and diagnosing. But we've all seen over the last 20 years a category of addictions broaden to look at gambling, sex and love addiction, pornography, spending, workaholism, those kind of things. So we've been able to expand it that there's other behaviors that don't have that acute withdrawal or acute tolerance or those kind of things. So we've had to expand our definition of addictions. But all those addictions are really, you know, the classical secular version of addictions are really superficial surface behaviors. And what we want to do is we really want to look at what's deeper, what's underneath those addictions. And as we look, you know, the Bible talks about idols of the heart, that everybody really has idols of the heart that are something that is dethroning God and is at the center on the throne. And then those, what we classically call addictions, are the manifestations or the behaviors that come out of having, you know, that idol that we have. Now, worship, the way I define worship, is perceiving God accurately and responding appropriately. perceiving God accurately and responding appropriately. So when we have an idol of the heart, we're not perceiving God accurately, because if we were, He'd be at the center of our heart. And we're not responding appropriately, and that's where we have the manifestation of the various addictions or the things that we go to meet that need or that idol is driving us to. Now these words perceive and respond, I want you to, those to be emblazoned in your brain, because we're going to talk about perceive and respond a lot. Perceive and respond. That's the heart of decision making, is perception and response. We're going to elucidate that a little bit more. So to me, the definition of addiction is choosing or pursuing something other than God in a habitual, patterned, or repetitive way to get a particular need or needs met. So choosing or pursuing something other than God, so not perceiving God accurately, and then in a habitual, patterned, or repetitive way getting particular needs met. So we're not responding appropriately. So we're worshiping something else. Now we all have behaviors that qualify as addictions, that grow out of the idols of our heart. We're all fallen. We all have other idols other than God at the center of our heart at various times of our walk. So we're all addicted. We're all addicts, is the mindset I have. So what we're going to talk about is a model that really looks at all of us. So whether you have somebody who has an overt addiction or somebody who doesn't have an overt addiction, there's some addictive processes that we all have. And I'm going to show that. And so the model of understanding it and intervening and treating you can apply to all the different people that you work with. What are we all addicted to? Anybody want to guess? Sin? Self? We're all addicted to comfort. All the things we do, all the behaviors, are really because we don't like to deal with pain. And we're going to talk about pain a little bit more later, but we don't like to deal with pain. We're born spiritually separated from God, so there's some significant spiritual trauma there. But pain is something that we just don't like to deal with. We say no pain, no gain, but in reality, we don't really want to deal with pain. So all the dysfunctional behaviors we have are there to comfort us, to anesthetize, escape, fantasize about, deal with the pain in some kind of real knee-jerk kind of way. So we're all addicted to comfort, and all the manifestations of these behaviors really come as a result of how do we find comfort? How do we comfort ourselves, soothe ourselves, and not looking to God first in that process? The consequences of addiction, Mark 12:30, 31, Jesus is asked, what are the greatest commandments? He says, love the Lord your God with all your heart, soul, mind, and strength, and love your neighbor as yourself. 2 little commandments, a short list of 3 things to do, but a very tough list of things. And this is what addictions really interfere with, our ability to have relationship with God, our ability to really love and have a good, healthy relationship with ourselves, and our ability to relate to others in a healthy way. The process of sanctification is a process of growing in that so that we are able to do those 3 things a little bit more frequently, a little bit more often, a little bit more fully as we really start to understand who God really is, to perceive Him accurately and then be able to respond in a much more healthy way. So spiritual consequence, it interferes with our relationship with God. Psychologically, it interferes with our social abilities with others and our understanding of ourselves and relating with ourselves in a healthy way. And physiologically, it's a toxin to our brain. Certainly chemicals, the substances are a direct toxin to our brain. But even making improper decisions impacts our brain chemistry in a negative way, and that's something we're going to flesh out a little bit more as we talk. Now, my daughter loves Aladdin, and now she's 9 years old, my youngest, and so we watched I Dream of Jeannie. We found those reruns, and she's always amazed that Tony Nelson never asks for all these rich, elaborate things. He always, doesn't want her to help with wishes, and she wants to grant any wish. What would you guys wish for? If you had your genie and you could ask for anything, what would you wish for? Any ideas, thoughts? Throw anything? Wisdom, wow. Guy jumps right to it, exactly. God, gave this option to Solomon. Said, Solomon, you can have whatever you want. I'm your genie. Wish for it, and it's yours. Solomon wished for wisdom. He wanted to be a good decision maker. Wanted to be a godly decision maker. God was so pleased with that, he said, boy, that's fantastic. You are right on the ball.